Good evening. It is Richard Southern here, and we on City News tonight are continuing to follow the crisis in healthcare. Toronto General Hospital does remain under an ICU bed alert at this hour. But things are not bad at all hospitals. For example, Humber River Hospital says it doesn't have a major staff shortage and hasn't had to close any of its departments. I spoke with Humber's CEO today to try and find out what its secret is.
Yes, we have some very good days at Humber. Things are better than they were, and we keep our fingers crossed every day that continues.
Good morning, everyone.
Barb Collins, Humber's CEO, says one thing the hospital's doing that others might not be is recruiting a lot of nursing students.
We bring in close to 2,400 nursing students every year. We do their education and their training. We make a very big effort to recruit them, and we work with them to get their licenses quicker, to be sure that they're passing their exams, and we bring them on as staff. It was a lot of extra work. I think we're seeing some of the benefit of that.
While there may not be any staffing-related closures at Humber River, those seeking care at the hospital still faced wait times longer than the provincial average. Patients' average wait time at Humber's Wilson site was almost 13 hours. Only 19% of patients were admitted to the hospital from the ER within the target time of 8 hours. Still, Collins says helping Humber River avoid the staffing problems that have faced other hospitals is the fact that it's invested in making its operations high-tech, including the use of artificial intelligence.
We have a command center, which we installed about almost 4 years ago now. It is a process flow command center that allows us, first of all, to manage our patients as they enter the hospital, how they flow from the emerge into the different beds, whether they're a patient that should be in a long-term care home and not the hospital. We monitor this very closely with large screens. Data automatically comes from the health record, large screens in our command center portray the information, and we have leaders who 24/7 observe, watch that, and help facilitate. The other thing that we have done is we've used patients' own health record information while they're a patient in the hospital. We have taken that data and we have brought it into the command center, applied some artificial intelligence to us, and it helps us in the command center help our staff and physicians monitor the sickest of patients.
Ask nurses like Sarah Fung how to fix the issues affecting hospitals, and they'll tell you it's all about how nurses are treated.
The answer is easy. We need to prioritize healthcare. We need to think about all of the positions that we put into leadership, like senior leaders. Do we need that many senior leaders, or do we need to put more money into frontline staff that deliver the care? At the end of the day, nurses are the backbone of the healthcare system. There is no healthcare without nurses, bottom line. And so we need to put those resources into not just recruiting, but retaining nurses so that they can stay and provide the healthcare that we all need.
If we're always going to say how terrible things are, we're not encouraging anybody to join healthcare. Who would want to join when you hear, healthcare is in a crisis? So we're trying to find methods and ways that we can be sure we try to prevent the crisis as much as we can. And then hiring staff is one thing, retaining staff is another thing. We have to work very hard on retention issues as well.
Now, both the nurse and the hospital exec in that story tell me they believe Bill 124, which caps nurses' wage increases at 1%, is an issue that is prompting some nurses to leave the profession. And the Humber CEO says while things are okay at that hospital staffing-wise now, she is concerned about what may happen in the fall amid another potential COVID wave.